Brainwaves are a window to the brain. They tell us how different areas of the brain are communicating. Each of the 5 different brainwaves are associated with a particular state of mind. For example, when your brain is externally focused and alert, the brain is producing beta waves. When your brain is calm and relaxed, it's producing alpha waves. The electroencephalogram, or EEG, is a non-invasive diagnostic tool that allows us to measure the different brain waves. As such, it provides a window to the brain and how well it is functioning. The EEG provides information regarding the dysregulation of brain waves, a condition known as neurological dysregulation. Neurological dysregulation refers to the inability of the brain to regulate itself. This results in miscommunication within the brain and the production of abnormal or atypical brainwave patterns. This condition may be caused by poor nutrition, emotional or physical trauma or stress, drugs and toxins, or a subluxated spine. Neurological dysregulation is associated with ADHD, migraine and tension headache, insomnia, fibromyalgia and chronic pain, as well as many others. It has also been shown to be a factor in Parkinson's, autism, and Asperger syndromes. Delta waves are considered to be the slowest wave in the frequency range of 1 to 4 Hz. These waves are produced during stages of deep sleep and are associated with the production of human growth hormone, which is necessary for growth, healing, and tissue repair. If a person's brain is unable to produce delta waves, then a deficiency of human growth hormone may result. This can lead to conditions such as fibromyalgia, tension headache, migraine headache, insomnia, and chronic pain. Theta waves are associated with a twilight state of mind. These waves are produced when your brain is falling asleep. They're associated with memory retrieval and creativity. However, when they are produced at inappropriate times, such as when a child is trying to concentrate in class, these waves may be associated with inattention and lack of focus. Over 25 different research studies have demonstrated that children and adults with ADHD produce unusually high levels of this wave. It has been suggested that measuring theta wave levels is the most accurate method for diagnosing ADHD. Alpha waves are also known as the meditative brain wave. This is because when a person meditates, the brain waves shift to alpha. Alpha is associated with relaxation, calmness, and a sense of well-being. Alpha is also associated with the ability of the brain to enter deep sleep. If a person's brain produces unusually low levels of alpha, then it will be impossible to enter delta sleep, a disorder known as insomnia. This finding has also been linked to conditions such as hyperactivity, migraine headache, tension headache, and fibromyalgia. SMR waves are the brain waves that are produced when a person is completely still and focused on one particular task. The Olympic high diver standing atop his diving board just before the dive, or the golfer standing perfectly still just before his swing, are just 2 examples of when the brain is producing SMR waves. The ability of the brain to produce high levels of SMR has been linked to decreased hyperactivity and an increased resistance to seizures. Several studies have shown that increasing levels of SMR may reduce grand mal seizures in epileptics by 70%. Beta waves are considered to be the fastest brain wave. The brain produces beta waves when the individual is alert and externally focused. Established research studies have demonstrated that children and adults suffering from ADHD produce unusually low levels of beta waves. This finding may help explain why these patients are unable to stay focused on certain tasks. On the other hand, if the brain produces too many of these beta waves, the individual may become hyperactive and anxious.